Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the disorders of muscles in children. Muscular disorders are due to progressive weakness of certain groups of muscles which may be muscular dystrophies or due to the diseases of the muscles. The onset is in the childhood, familial and affect the proximal groups like shoulder or the pelvic girdle. Muscular atrophies are often secondary to neural lesions. These are seen late in the life, not familial, involved with distal muscle groups like wrist and foot. Investigations: serum aldolase, creatinine, phosphokinase, CPK, serum glutamic oxaloacetic acid, transaminase, SGOT, and lactic dehydrogenase, LDH. All are helpful in diagnosis and prognosis of the muscle disorders. Electromyographies, EMG, are useful study to differentiate dystrophies from atrophies. Muscle biopsy. It is very useful method to differentiate many clinical entities and as a prognostic guide. Muscular dystrophies, characterized by the atrophy of various skeletal muscle groups. Clinical types: pseudo hypertrophic muscular dystrophy, Dystrophy type. It is the most common form. Onset is between 3 to 5 years of age, rarely in infancy or late in the third decade. Irido-familial disposition is noted. It primarily affects males and transmitted as a sex-linked recessive character. Pseudo-hypertrophy of the calf muscles appear first, then symmetrical weakness of pelvic muscles, then the shoulder muscles, waddling gait, lumbar lordosis, difficulty in climbing the stairs and difficulty in getting up to erect position. Mild mental retardation may occur in some cases. Cardiac involvement is seen as the disease progresses and the antibiotics help to drag the life. Limb girdle type. It affects both the sexes, starts in the second or third decade and slowly progresses. This involves the shoulder and pelvic girdle. Pelvic femoral type. Leiden-Mobius type. This form is inherited as an autosomal recessive affecting both sexes. Quadriceps and hamstring muscles show extreme weakness. Calf muscles are pseudo-hypertrophied. It progresses slowly. Facioscapulohumeral type. Landauer-Desrin type. The disease is an autosomal dominant, affects both the sexes, may start at any age up to 20 years. Face and shoulder muscles start first and spread to pelvic muscles after several years. It may abort spontaneously. Ocular myopathy starts with ptosis, weakness of orbicularis oculi, external ophthalmoplegia and dysphagia. If generalized muscular dystrophy is not there, prognosis is good. Treatment: moderate to regular exercise sizes should be carried out with the guidance of a physiotherapist. It is important to continue schooling or work for psychological reasons. Infections and cardiac failure must be treated promptly. Ocular myopathy treated with the steroids and plastic surgery to correct the ptosis. ATP injection given in a dose of 5 to 40 milligrams once or twice a day, IV or IM or SC, or 40 to 80 milligrams dissolved in 5% dextrose 500 ml as a drip over a period of 1 hour. The floppy infant syndrome has been divided into two groups, paralytic group and non-paralytic group. Paralytic group, infantile form, Warding-Hoffmann disease. It is transmitted by autosomal recessive gene and characterized by degeneration of anterior horn cells. Symptoms are present in utero. Loss of femoral movements, limbs, immobilized arms, abducted and flexed lying on side of head. Legs externally rotated and knees flexed. Frog position. Recession of lower rib and fasciculation of the tongue. Jacks are absent and no sensory loss. Spinal muscular atrophy of Wilander and Kesselberg, onset between 2 and 12 years, severe in males. Myasthenia gravis, neonatal disease, may present a floppy infant syndrome. Arthrogryposis multiplex congenita, myodystrophia fetalis. In the uterus, voluntary muscles are replaced by fatty tissues. Have many deformities like club feet, flexion deformity, etc. Non-paralytic group, mental deficit and hypotonic children with Down syndrome and atonic cerebral palsy. May exist floppiness with paralysis. Benign congenital hypotonia, spontaneous movements are there but weak. Fasciculations of the tongue absent and sometimes deep jerks are present. Some children may recover completely. Myasthenia gravis. It is a disorder of myoneural junction weakness and fatigability of muscles inverted by brainstem bulbar innervated muscles. The muscles of face, tongue, throat, respiration and extraocular muscles are affected. Common after 10 years of age and girls. It may be the autoimmune disease in use of antibodies in the serum. Types: neonatal myasthenia gravis, myasthenia congenita, juvenile myasthenia gravis. Diagnosis: neostigmine test. Neostigmine with atropine is given SC and observed after 30 minutes for muscle reaction. Treatment: supportive treatment consists of injections, suction of secretions, respiratory assistance and good nutrition. Drugs: neostigmine bromide 15 milligrams orally 2 or 3 times a day. Ephedrine sulfate, atropine, endrofonium chloride, immunosuppressive drugs and steroids. Thymectomy surgery for adolescent girls. That's all about the disorders of muscles in children, and in the next video I will discuss about some other diseases. Thank you.